Welcome. Herpes virus. Properties of the herpes virus: envelope, double-stranded DNA virus, genome consisting of long and short fragments which may be oriented in either direction, giving a total of 4 isomers. 3 subfamilies: alpha herpes virus, HSV1, HSV2, VZV, herpes simplex, beta herpes virus, CMV, HHV6, HHV7, gamma herpes virus, EBV, HHV8. Set up latent or persistent infection following primary infection. The activation are more likely to take place during the period of immunosuppression. Both primary infection and reactivation are likely to be more serious in immunocompromised patients. Herpes virus particles. HSV2 virus particle. Note that all herpes viruses have identical morphology and can be distinguished from each other under electron microscope. Herpes simplex virus belong to the alpha herpes virus subfamily of herpes virus, double-stranded DNA envelope virus with a genome of around 150 kilobytes. The genome of HSV and HSV2 share 50 to 70% homology. They also share several cross-reactive epitopes with each other. There is also antigenic cross-reaction with VZV. Man is the only natural host for HSV. Etiology: HSV is spread by contact, and the virus is shed in saliva, tears, genital, and other secretions. By far the most common forms of infection result from the kiss given to a child or adults from a person shedding the virus. Primary infection is usually trivial, or subclinical in most individuals. It's a disease mainly of very young children, those below 5 years. There are 2 peaks of incidence, the first 0 to 5 years, and the second in the late teens when sexual activity commences. About 10% of the population require HSV infection through the genital route, and the risk is concentrated in young adults. Etiology: generally HSV1 causes infection above the throat and HSV2 below the belt. In fact, 40% of the clinical isolate from the genital source are HSV1, and 5% of the strains isolated from the facial area are HSV2. This data is complicated by oral sexual practices. Following primary infection, 45% of the oral infected individuals and 60% of the patients with genital herpes will experience recurrence. The actual frequency of recurrence varies widely between the individual, and the mean number of the episodes varied in about 1.6. Pathogenesis: during the primary infection, HSV is spread locally and a short-lived viremia occurs, whereas the virus is disseminated in the body, spread to the craniospinal genital vein, established latency in the craniospinal ganglia. The exact mechanism of latency is not known. It may be true latency where there is no viral replication or viral resistance, where there is a low level of viral replication. Reactivation: it's well known that many triggers can provoke a recurrence. They include physical or psychological stress, infection, especially pneumococcal and meningococcal, fever, radiation, including sunlight, and masturbation. Clinical manifestation: HSV is involved in a variety of clinical manifestation, which is acute gingivitis, herpes labialis, cold sore, ocular herpes, herpes genitalis, other forms of cutaneous herpes, meningitis, encephalitis, neonatal herpes, oral facial herpes, acute gingivitis. Acute gingivitis is the commonest manifestation of the primary herpetic infection. The patient experiences pain and bleeding of the gum, 1 to 8 mm ulcer with necrotic bases of present. Neck glands are commonly enlarged, accompanied by fever, usually a self-limiting disease which lasts around 13 days. Herpes labialis, cold sore following primary infection, 45 percent of the oral infected individual will experience reactivation. The actual frequency of recurrency varies widely between individuals. Herpes labialis cold sore is a recurrence of oral HSV, a prodrome of tingling, warmth, and itching at the site usually heralds the recurrency. About 12 hours later, redness appears following the bipolar papules and then vesicles. Gingivostomatitis. Ocular herpes HSV causes a broad spectrum of ocular disease, ranging from mild to superficial lesion involving the external eye to severe sight-threatening disease for the inner eye. Diseases caused include the following: primary HSV keratitis, dendritic ulcers, recurrent HSV keratitis, HSV conjunctivitis, iridocyclitis,